Thank you. I'm going to convince you that everything you just heard was completely wrong, and you're going to vote for our side. So doxycycline has been around for a very long time. It was first licensed in 1967 by Pfizer under the brand name Vibramycin. And doxycycline, in addition to using it for PEP, as we're discussing, it's been used for pre-exposure prophylaxis, or PrEP, since 1971 for malaria. In fact, the first time that I came to Bangkok as a young backpacker in 1994, I carried a bottle of doxycycline to use, because at that time, for Westerners, they recommended malaria prophylaxis. It's the most common antibiotic prescribed for acne in America. We just heard that we might actually have 2.5 million people getting doxycycline just in America alone. Well, actually, there's already 3 million people in America that are getting doxycycline for acne. It's also active against the organisms with the highest potential for bioterrorism, including anthrax, tularemia, and Yersinia pestis, or the plague. And in addition to antimicrobial effects, it also has anti-inflammatory effects. I was also given doxycycline for an episode of reactive arthritis that I had in my younger years. It's used for sarcoidosis, and it's also used to prevent abdominal aortic aneurysms from exploding or exsanguating and killing people. The tolerability of doxycycline is very, very high. We have a lot of data, and this is data from use for PrEP for malaria. And you can see that when used in Asia, including Thailand, Indonesia, and Cambodia, there are very, very few side effects, and very few people have to stop it because of side effects. Very high acceptability for Doxy PrEP among the population, MSM, that is currently targeted. There's not very much knowledge about it yet in the community because it's very new, but when people are asked, very high proportions say that I would take it, this is a good idea. So I knew ahead of time that their main argument was going to be about resistance. So let's take that on. So first, doxycycline remains sensitive to a large number of organisms, which is why we use it so much. It's useful for STIs, and we know that the gonorrhea already has resistance to doxycycline before doing this, and resistance may be 90%, but if 10% of gonorrhea is still sensitive and we can prevent 10% of gonorrhea infections, that's better than preventing 0% of gonorrhea infections. It's active against malaria, bioterrorism agents, and it's the first or second line treatment for a lot of organisms to this date. So resistance. So we had resistance to doxycycline before we had doxycycline. First resistance to the tetracycline family of drugs was discovered in 1953, which was a full 8 years before we had doxycycline. And we know that resistance is common in a lot of different organisms, especially gram-negative organisms, but some gram-positive organisms as well. And in one RCT that you can see here of Doxy PrEP among MSM, after taking Doxy PrEP for 1 year, they found no resistance in Staph aureus among the two groups. So at least in this one clinical trial, it did not cause any increase in resistance in other organisms. So I always like to end my talks with a top 10 list. So these are the top 10 reasons for Doxy PrEP. And if you know anything about top 10 lists, we start with number 10 and then we count down to number 1, or the most important. So number 10, so Doxy is better than having syphilis. Doxy is better than having chlamydia. It is better than having gonorrhea, and 10% less gonorrhea is better than 0% less gonorrhea. It's better than malaria. It is way better than exploding abdominal aortic aneurysm. That's kind of gross. Sex is fun, but it's even more fun if you don't have to worry about STIs while you're having sex. Condoms are not fun. Yes, they are very useful. I'm not saying condoms are bad, but nobody in the world says that condoms are fun. Bioterrorism, no way is that fun. It's very, very inexpensive. If you go out to a pharmacy across the street here, a few baht per pill for doxycycline. So next is number 1, and number 1 is my favorite. I think this will be your favorite as well. Resistance is tetracycline's fault. Do not blame doxycycline for resistance. Thank you.